Trump administration did ask states to speed up vaccinations for people 65 and older, as well as those who are high risk. Just yesterday, New York Governor Andrew Cuomo addressed vaccine rollout in day one of his State of the State address. Joining me now to talk about more on the agenda is Lieutenant Governor of New York, Kathy Hochul. Good morning to you, Lieutenant Governor. Thanks for being here.
Good morning.
So you heard right there from the Trump administration this morning asking the states stop holding back the second dose of the vaccine so that more people can get that first dose. Now 65 and older. Ultimately, it's up to the states to decide. Is that something that New York would consider?
Well, let me start with where the doses come from. If the federal government wants us to administer more doses, then give us more than the current allotment of 300,000 doses a week. That's all we get from the federal government for a population of 20 million people who will need not one but two doses. So we have to deal in reality here. They are not giving us enough. But we are also making sure that, and I was at some sites this week in upstate New York where they're giving out the second doses to healthcare workers in hospitals. So we're going to make sure we have enough supply for the people to make sure it's fully effective for these front-facing individuals who are exposed to the virus every single day. But do we want to get to 65 years and older? Absolutely. We are trying to push this as hard as we can, working in every corner of the state to set up mass distribution sites. They're going to be opening more this week and next week. So working with that level all the way down to the local pharmacies. We have a game plan. Yep. We just need the doses.
So I hear what you're saying there, but New York received 1.2 million doses. Around 500,000 of those actually went into the arms of people, leaving 500,000. In fact, the New York Times reported that there were health officials who had to throw out vaccine doses because they had no patients to give them to and they were expiring. Have you heard about those concerns? Is there this rumor of doses languishing in freezers?
Early on, we were told that we wanted to make sure that they get into the arms of people in hospitals. And in a few cases, there are in situations where hospital may have been done with it, and we needed to have those transferred to other locations. We have expanded the categories of individuals eligible for this as of last week, so those situations should not be occurring. We want to make sure that no dose is ever wasted, that we can get them out as soon as possible. I think everyone understands the very first priority was nursing homes, the most vulnerable population where people are dying at higher rates, and the people who take care of them, as well as our healthcare workers in hospitals. But we're now able to expand. That's the good news. We're beyond that now. We're able to expand to essential workers, teachers, firefighters, police officers, and people who are in stores and dealing with the public all the time. So we're in a much better place than we were even a week ago.
There seems to be this disagreement on the order of who gets vaccinated and when between Governor Cuomo and Mayor de Blasio. Are they in constant communication in terms of who gets the vaccine and when?
Of course we're in communication. We have cities, our largest city in the state of New York. But that being said, we want to make sure that it's done in a smart way, following CDC protocols. We've been following them. It was nursing homes, it was hospitals first. Now working with the city in every corner of New York, we are able to open up to a larger population. That has been worked out.
So what is being done to expedite vaccine distribution, specifically in areas where you know that there was a social and racial component when it came to disproportionately affecting those communities in terms of coronavirus as a whole?
Huge priority of ours, and the governor established a New York State Health Equity Task Force with representatives in every corner of New York to make sure that we address where the need is greatest, and it has been Black and brown communities. He talked about that in his State of the State address just yesterday. So we're working with clergy and senior centers and in public housing, non-traditional places where we know there's healthcare deserts. It's not easy to walk into a corner pharmacy in parts of the city that just don't exist. So we have to be more thoughtful. We've been working on this since the summer to have a distribution plan that is inclusive, is racially diverse, and make sure that we hit all those points where Black and brown communities in particular can get the vaccine soon because they have been disproportionately impacted. That has to end. That is one of our highest priorities.
And lastly on this topic, when do you see then opening up the floodgates for everyone to be vaccinated or getting everybody vaccinated? Mid-2021?
Well, we know that's going to take 14 weeks in order for us to get through the first healthcare category and also what we call 1B, which is the essential workers, which I just described. Once we get past April now, then we'll be able to open up to a broader population. So we're hopeful that by summer, early fall, we have it available to anybody who wants to walk into a pharmacy, a doctor's office, or in a unique place like a community center, public housing, or in your church. Right. We have to be creative about this. We have to overcome a lot of hesitation, though. There are people saying, They don't want to get it because of historic grievances where the federal government has taken advantages of communities of color, use them as guinea pigs. They have to be assured and have the confidence to know that this is being done fairly and equitably, and that's what we're focused on as well.
And a lot of things being done on this two-parter of the State of the State address. So today we're going to be focusing on other issues. Also on your agenda, and I just want to touch upon it as well. We only have 30 seconds left. Domestic violence, which is a big, big topic for you. What changes are you hoping to make this year?
Yeah, this is something that touched my family. My mother grew up in a home with domestic violence, and we helped establish a shelter for people. We are going to make sure that people who are abusers pay for it. There's a reason why some people stay in abusive settings. They can't afford to get a new house. They can't get an apartment. They can't afford the cost. Abusers need to pay for their crimes, and also make sure that we have more resources available to people who are literally captive in their homes with an abuser during this crisis. So it's a high priority of all of ours.
That is a segment we can talk about on a standalone segment. So you're welcome back to talk about that. Lieutenant Governor Kathy Hochul, thanks for being here this morning.